Hey guys, welcome back. Today's video will discuss an incredibly common issue in pregnancy, low back pain. We'll talk about how to know if it's a more serious issue, what are the most common causes, and what you can do about it. Hey, it's Leah, and you're watching Mommy in the Moment. If you're not new here, welcome back. If you're new, welcome to my channel. Here we talk about motherhood, lifestyle, pregnancy, and everything that connects them from a doctor's perspective. It's me, I'm the doctor. Today we're going to talk about low back pain in pregnancy. It is one of the most common complaints that I see in my patients, low risk and high risk patient population. It's so common, and so I think it's worth having a discussion about what are the common causes, when is it more serious, and what can you do about it? Now, first of all, disclaimer, if you are having serious back pain and you feel like something is wrong, you need to talk to your healthcare provider about that. This video is meant for informational purposes only. This is my opinion and my experience. I hope that it's helpful, but this is not a replacement for medical care. Okay, so let's jump into it. What are some of the most common causes for low back pain in pregnancy? So there's many different causes. One is that there's a hormone called RELAXIN that is released starting very early in your pregnancy, and it starts to loosen up all your joints. The purpose of this hormone is to loosen up the joints in your pelvis so that it can allow the baby to come through. Now, this loosening of your joints leads to a couple of different things, okay? It leads to increased lordosis of your lower back. That is the forward sway of your low back. That's a very common change during pregnancy, especially as you're carrying more weight in front. That the weight tends to pull on your lower back and pull it a little bit out of alignment. A relaxin can also do something else where the joints that don't usually have a lot of motion around them, things like your pubic symphysis or your sacroiliac joints, they start to have a little bit of motion in them. And that can lead to muscle spasm around those joints. And that can make you have more back pain than you normally would expect. Muscle weakness is something that can cause low back pain in pregnancy, and low back pain in general, let's be honest. So weak abdominal muscles, so your abdominal muscles are your rectus muscles, your transversus muscles, your obliques, you have internal and external obliques, so it's a whole kind of sheath of muscles all the way around, and the strength of those muscles support your low back. Now, if you get pregnant and you were working out your abs and now you're not, or just your growing belly brings your abdominal muscles out of alignment. They're not as efficient as they used to be. And that lack of support can cause pain or discomfort in your low back as well. Another muscle that can get weak and cause issues is called the gluteus medius. Now, we think about the gluteus muscles as the gluteus maximus, the big one that makes your bottom round. But the gluteus medius is a stabilizing muscle. Now, I'm going to try to insert a video. I think everybody has seen somebody, maybe an auntie in the church or somebody who walks like this. Have you guys seen that before? That side to side sway of the hips, that hip dropping, means that the gluteus medius muscles are not strong and they're not stabilizing the low back. All that movement in the low back can lead to strain and pain of those muscles. So if we can keep those muscles strong, then we'll have much less movement in the low back and a lot less discomfort. The last thing that can cause issues with low back pain is muscle tightness. Not just the low back muscles themselves. The muscles that we're talking about are the erector spinae, so those muscles that run right up and down the spinal column, and the quadratus lumbarum, that's kind of goes between your bottom ribs and your hip bone. Those muscles can definitely get tight, but all the muscles around your hips and pelvis, if they get tight or they're out of balance, then you can definitely have a lot more back pain. So I'm talking about your gluteus maximus and medius, your piriformis, which is a very small muscle way down deep, kind of under your gluteus muscles, and your hip flexors, and your hamstrings. Do not forget your hamstrings. So if we can keep all of these muscles nice and relaxed, then that's gonna take a lot of stress and strain off of your low back. Now, the question is, okay, well, we have all of these, common reasons why you have low back pain. That just seems like, oh, we can address those. But how do you know if it's something more serious? Common pregnancy back pain is associated with prolonged sitting in one position, prolonged standing or prolonged walking, moving a certain way, rolling over in bed. Those kind of things can cause the most common pregnancy back pain. If you're having back pain that is not associated with movement or kind of comes and goes in a rhythmic fashion every 5 minutes, every 10 minutes, if it's intangible, you don't feel like you can touch it, like you can't put your finger on the muscle, and it feels kind of like period cramps, that kind of deep, dull ache, and it comes and goes and comes and goes. And maybe you touch your belly whenever you're feeling this back pain, and it gets tight and it goes away, and it gets tight and it goes away. Those things may be a symptom of contractions, and if you're early in your pregnancy, it may be a symptom of preterm labor. So, like I said, back pain that is not associated with movement, prolonged walking, prolonged sitting, that's independent of those things, that's rhythmic in nature and is associated with abdominal tightness, those are things that you need to call your provider about and have evaluated. All right, so let's say you have the more common sort of low back discomfort in pregnancy. What can you do about it? Well, I'll tell you. I'm glad you're still here because we are going to discuss, or I'm actually going to demonstrate for you some of the different ways, some of the different exercises and stretches you can do to help relieve your low back pain.
All right, this position is called cat-cow. You get on all fours with your knees directly under your hips, hands directly under your shoulders. You press your back up to the ceiling and then let it drop down to the floor. And this helps with spine mobility, stretching through those low back muscles, but also keeping the joints loose in the extension position. Now you can also use this position to go into a modified child's pose, where you push your hips back towards the wall behind you and rock back and forth. I'm going to change my angle so that you can see a little bit better. So push your hips back and rock back and forth, and that really helps to stretch out those erector spinae muscles, those muscles right up and down your spine on either side. This is a seated side bend. So sit on the floor, cross-legged position, put one hand down on the floor and try to get your elbow down to the floor. Now don't let that hip pop up. You want to keep both of your sit bones right down to the floor and lean over. Now to make sure you do that on both sides. Hand out, elbow down, sit bone down to the floor. And you can raise your arm up and roll back, roll forward. See where you feel that stretch the best. Here I'll turn so that you can see it from the back. Again, cross-legged position, hand out to the side, elbow down as close as you can get it to the floor without raising that hip. Don't raise the hip, keep it down. If you can't get your elbow to the floor, that's fine. Go as far as you can and really stretch through that low back. Arm up, rock back, rock forward. You can really feel that nice stretch. Now this is a seated piriformis stretch. This stretches that very small muscle down below, kind of deep to your gluteus muscles. Don't arch your back. Sit up straight like someone's pulling a string from the top of your head and lean forward. Now you'll feel that even just when you sit up straight. Lean forward, take some deep breaths. Make sure that you do it on both sides. This can also be done sitting in a chair if sitting on the floor is too intense. But sit up straight, lean forward, and you can feel that deep down in your bottom. Now this one is great for stretching through the hips and stretching the hamstrings. So you can use a yoga block or some support to help you if you can't get all the way down. Make sure you're not arching your back. I want you to do a pelvic tilt. Roll those hips forward and really put that stretch through your hip flexor muscle. Lunge to the front. Try to keep that front knee at no more than a 90-degree angle. And you can use your blocks to help you support yourself. Take some deep breaths. Really stretch through. And then lean back and you can get a good stretch on your hamstring on the opposite side. I like this hamstring stretch because I'm not standing and hanging my head down. I guess makes me dizzy these days. You lunge forward, take a few breaths in each position, back and forth, and it really helps to stretch through those muscles and loosen everything up. Now, if you want to kick it up a notch, here's a rope that I got when I was running track in college. I've just tied a loop on one end. You can lunge forward and then use that rope to help pull your foot towards your bottom. Now make sure that you keep your hip rotated forward, and that just intensifies the stretch on the hip flexor and includes the quadricep muscle as well, that muscle right across the front of your thigh. Now this is the first of our strengthening exercises. This is called a clamshell. So what you do is lay on your side, put your feet together, bend your knees in front of you, and lift that knee up to the ceiling. This helps to strengthen that gluteus medius, that stabilizing muscle. Now if you want to kick it up a notch, raise your hips at the same time. It may not feel intense at first, but do 3 sets of 10. You will feel it. And then lastly, this is an exercise to help strengthen those transversus muscles. You don't want to do a lot of exercises like crunches and planks, especially if you already have abdominal separation. What you can do is take a deep breath, and as you breathe out, pull your belly button straight back towards your spine. And hold it, and as you breathe, let it go, and then pull those muscles tight, belly button against your spine. That helps to keep engagement of those transversus muscles, those deepest muscles of your core, to help strengthen and support your abdominal wall, but also your low back.
All right, give these exercises a try. I think that I really have had much less back pain with this pregnancy than I have with either of my first two, because I've focused much more on keeping my hips strong and keeping them stretched out. Now, stretching can be a part of your bedtime routine. It can be a part of your self-care. One of my favorite things to do is to take a long bath and put on a diffuser or some like essential oils, turn on some nature music, and do deep breathing while I'm doing these stretches. And I tell you, it feels amazing, and I feel like I sleep better. I sleep much better after I've done kind of the relaxation and stretching. So I hope these things were helpful. Definitely, if you think that your back pain is not just simple musculoskeletal back pain, but something more, talk to your provider about that. I've had patients that maybe failed these exercises, but we knew they weren't in preterm labor, and we referred them to physical therapy. Physical therapy is awesome. They're like having a personal trainer for like a specific issue. So see if your provider is willing to facilitate that for you. I hope this was great, really helpful information. Back pain is normal in pregnancy, but we can minimize it. We don't have to suffer with it. If we put in a little bit of effort, we can really feel a lot better and enjoy the second and third trimester so much more. All right, guys, comment down below, what have you done to decrease your back pain in pregnancy? What other physical issues would you want me to discuss as well? Subscribe to the channel and like this video if you felt like it was helpful. Share it with someone that you think could benefit. I'll see you in the next one. Bye.